Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Churches, mosques to reopen, but with new guidelines, while schools are to remain closed for now. Kogi State Governor bows to pressure, orders lockdown of Kababunu local government area over coronavirus conflict. And fears of more COVID-19 cases mount in England following reopening of schools. Kogi State has been in the news recently whether or not it has a confirmed case of COVID-19. While the Nigeria Center for Disease Control NCDC Director General revealed that 2 cases are confirmed in the state, the governor and his team dismissed claims that there is no coronavirus in the state. Now, this debate has drawn in several interest groups, including the Nigeria Medical Association, NMA, who argue that more tests should be carried out to ascertain the COVID-19 status of the state. On our theme this evening, we examine the controversy surrounding coronavirus and the confluence state. Nigeria recorded 307 new cases of COVID-19 in 14 states and the Federal Capital Territory, according to the figures released by the Nigeria Center for Disease Control (NCDC). The country now has a total of 10,162 confirmed cases in Nigeria, with 3,007 patients discharged and 287 deaths recorded. A breakdown of the figures by region shows that Lagos in the southwest has the highest number, with 4,943, still followed by Kano in the northwest with 954 cases. The FCT is next in the north central, the third highest tally in the country with 660. In the northeast is Borno State, the highest figure at 271, while Edo in the south-south has 284. Ebonyi in the southeast has the highest also in that region with 40 cases. The Presidential Task Force today briefed the nation on the decisions taken after the meeting with President Muhammadu Buhari. The chairman of the task force and secretary to the government of the Federation announced the lifting of bans on religious gatherings and the commencement of the second phase of the ease of lockdown for 4 weeks beginning tomorrow.
And the President has approved the following for implementation over the next 4 weeks, spanning from tomorrow, the 2nd of June, to 29th June 2020, subject to review. 1, a cautious advance into the second phase of the national response to COVID-19. 2, application of science and data to guide the targeting of areas of ongoing high transmission of COVID-19 in the country. 3, mobilization of all resources at state and local government levels to create public awareness on COVID-19 and improve compliance with non-pharmaceutical interventions within communities. 4, sustenance of key non-pharmaceutical interventions that would apply nationwide and include the following. A, ban of gatherings of more than 20 people outside of a workplace. B, relaxation of restriction on places of worship based on guidelines issued by the Presidential Task Force and protocols agreed by the state governments. C, manage access to markets and locations of economic activity to limit the risk of transmission.
And for the National Coordinator of the Presidential Task Force, Dr. Sani Aliyu, the goal of Phase 2 is to balance public safety and livelihood. He listed some conditions that must be met to achieve the goal.
The nationwide curfew will remain in place, but the timing of this will be reduced to 10 p.m. to 4 a.m. And just to clarify, the purpose of the curfew is to limit social interactions and therefore reduce the risk of transmission of the virus. Persons that are on essential duty, including but not limited to those involved in the provision of healthcare services, media services, and critical infrastructure are exempted from the curfew. 2. All interstate travel by individuals remains prohibited except for essential travel and the movement of goods and services. Just to make it clear, all restrictions on the free movement of goods and services is now removed in this phase. 3. There will be full opening of the financial sector, with banks now allowed to operate normal working hours 5 days a week. 4. The mass gathering of more than 20 people outside of a workplace or places of worship remains prohibited. 5. There will be controlled access to markets and locations of economic activities, but local authorities will continue to provide guidance on opening times.
So the Presidential Task Force there putting out another guideline into the advancement of phase 2 in the ease of lockdown protocol. Joining us right now from our Abuja studio is Dr. Ogbonnaya Heme. He's the medical doctor, Prime Care, medical director, Prime Care Abuja. Thank you for joining us at this time. I'd like to begin by asking, because we're seeing other countries who are easing lockdown, relaxing lockdown because their numbers, COVID-19 numbers, are coming down, but we're seeing a lot of increase, daily rise in cases in Nigeria, and the PTF is coming with this ease of lockdown. What do you make of it?
Yeah, good evening, Millicent. A pleasure always to be here. I think quite unlike what other countries have been doing, where the lockdown is eased once the numbers are coming down. Now, I think in our own case, the issue now has to do with stimulation of the economy. We are afraid. We are worried that the Nigerian economy is gradually sliding into recession. So the earlier we actually do away with as much as possible, try to reduce the lockdown. Ease the lockdown. And stimulate the economy and improve the economic indices of the country. I think that's actually what informed the reason for the PTF taking such steps.
So I guess many people would be asking, is the government prioritizing the economy over public health and public safety? Maybe we'll leave that for an economist to answer. But looking at some of the guidelines that they've put out, there's also the restricted opening of places of worship. And also there's the caveat, state protocol. So states have also started easing on that. Do you expect that some of these measures, these guidelines, these protocols would be adhered to in a setting like that of, a church or a mosque?
Yeah, the protocols that have been given are not actually difficult to adhere to. I'm sure by the time because before the lockdown, this particular phase of the lockdown was implemented, meetings were actually held between the PTF, the Presidential Task Force, the state officials, as well as the religious organizations, where we actually had an understanding that most of these protocols have to be observed. And the fact is that being a very responsible organization, one expects that these religious organizations, be they mosques or churches or shrines, as the case may be, should be able. The protocols are not actually that difficult to abide by. We're talking about the temperature monitoring. We're talking about social distancing. We're talking about hand sanitizing and all forms of preventive measures. So I'm sure the religious organizations in this case, being very, very responsible organizations, we expect that they're actually going to incorporate this into part of their modes of worship, and as much as possible, it's going to help us, if not bring down the numbers, but at least limit the rate of spike.
The PTF also talked about the high-burden local government areas, about 20 of them of the 774. In tackling community transmission, what are some of the things that perhaps the committee should be looking at doing in those local government areas?
Yeah, you know, like if you're talking about community spread in those local government areas, one of the things I think we should also be very much interested in is, gatherings, mass gatherings. You're talking about, cultural gatherings. We're talking about meetings, all different cultural organizations and so on and so forth. Of course, don't forget religious gatherings we're also talking about. I think that the committee should also, as much as possible, put to, sensitize as well as see to proper implementation of those guidelines at those levels. I mean, of course, while also, as much as possible, improving sensitization of the indigents of such local governments. I'm sure by the time most of these practices are put into place, as much as possible, going to help reduce as much as possible community spread in those local governments of concern.
If you compare what we've had, the previous lockdown ease, the measures we've come from a total lockdown in Lagos, Ogun and Abuja to where we are now at this point, also seeing the new guideline, which is the timing of the nationwide curfew from 10 p.m. now to 4 a.m., which it says is to limit social interactions. Do you expect that we would have lower figures, cases of COVID-19, or more figures?
Well, I think all the efforts, all the protocols they put out are well thought out. And I honestly, to be on the safe side, I think there might not be, there may not be an increase in the figures. We may actually have a plateau as far as those figures are concerned. So that by the time we now review, probably in the next period, in the next period of assessment by the PTF or the agency in charge, the NCDC and so on, I'm sure that will encourage them as much as possible to, now to do, to continue with the practice that is being, as much as possible being adhered to by now.
And a lot of people want to see the flattening of the curve. We appreciate your time, Medical Director, Prime Care Abuja, Dr. Ogwuneye Iheme. Thank you for joining us on the program.
Oh, it's my pleasure.
Now, the governor of Kogi State seems to have bowed to pressure as he has ordered a total lockdown in Kaba Bunu local government area for an initial period of 2 weeks beginning from tomorrow. Governor Yahya Bello announced this today in a press conference in Lokoja, the state capital. He also called on the people of Kaba Bunu local government council to exercise patience and cooperate with the committee so that adequate tests can be carried out during the 2 weeks total lockdown. Governor Bello further directed that the management of the federal medical centers in Lokoja isolate doctors and any health officials that participated in moving the man and son alleged to have contracted the virus to Abuja.
2020. The question that Kogi State is surrounded by 10 states, including 10 borders, including that of FCT, and that these various states are afflicted or inflicted or affected by COVID-19, and that Kogi State must have. I say it's lie. It is false. That is where effective leadership is tested. Here in Kogi State, we have effective leadership, and we have very respected and effective followership. And our people took to our words very well, and they protected themselves, they protected the community, and they protected the society. So imposing this particular lockdown in Kaba Bunu local government is very painful. But we have to take the decision as a result of this purported allotment in order to clear the air. Kogi State remain COVID-19 free. And let me quickly clear the air once again. We have nothing to gain as a state government or as a governor or as incident managers or as security agencies by hiding any case. If we have any genuine confirmed case, we shall come out to announce it to the world.
We have more on the COVID-19 response strategy in Kogi State when we return. Welcome back. And let's continue with the state, Kogi State, that insists it is COVID-19 free. Meanwhile, the NCDC is saying that it has recorded 2 cases. Joining us to talk about this is a consultant family healthcare physician, also a clinical director, Trust Caritas Hospital, Jabi, Abuja, Dr. Safiya Uda. Thank you for joining us on the program.
You're welcome.
Dr. Wuda, are you worried that there is a possibility that in the fight against COVID-19 appears to be marred by maybe what some call political tricks or tricks for political attention?
Thank you very much. Yes, I'm so worried and concerned about it because the fight against COVID-19 is not something to play with. We know now that a lot of citizens in Nigeria, our citizens in Nigeria don't even believe COVID-19 exists because they believe everything has been politicized. So we need to do more. I'm worried because when you politicize everything, especially health, talking about health, you're politicizing health issues. It's not going to have we're not going to have a good solution to to combating this COVID-19 virus. So I'm a bit concerned about that because we need to do things rightly to have a solution to the pandemic.
Let's take a look at what we're seeing in Kogi State. The governor insists that that Kogi State is COVID-19 free, and then we're seeing the NCDC saying that there are 2 persons who have confirmed cases of COVID-19. How do you think they can resolve this issue?
I think it's a very simple issue. If the governor is saying Kogi State is COVID-19 free, it's nothing to really worry about. The main thing is, what was his take? His take was that the NCDC personnel coming should be quarantined, which is not really against the norm, that when you're coming from a high, an endemic zone to a zone that you think the virus is not present, you should be quarantined. Just like the way the Chinese people, when they came into the country, we had to quarantine them for 2 weeks. So I think we need to come to understand his own perspective about this situation now, saying that, okay, it's 19. I know without testing, we can't know if there is COVID. But he's saying that if there were cases of COVID-19, yes, we know some cases could be asymptomatic. But his belief is that, okay, there are no cases of death, though we are not waiting for there to be death from COVID-19, or cases of even doctors having symptoms, having patients that show symptoms of COVID-19. So I think if he's saying people should be quarantined before coming to his state, it's not really out of point. So I think we should, he's making a sense from that. So he's thinking his people has not come down with any symptoms suggestive of that, because we have doctors, that trained doctors in Kogi State, and if there are symptoms of COVID, they should have a high index of suspicion.
Looking at perhaps what a number of people have said, medical and other Nigerians, they've questioned the stages of sample collection, the labeling, the turnaround test time. Do you think that could also be a problem in the case of Kogi?
Yes, not even only in Kogi, all the states, the time taken for results to come after sample is being taken should be made shorter. Because people keep thinking, oh, even if the sample is taken, it will take some days. Before then, people might have been so anxious, some may become depressed, have some kind of anxiety. So I think more needs to be done. When we're talking about COVID-19, it's a pandemic. We don't need to politicize health issues. We need to take it more serious. Prior to COVID-19, if you can remember vividly, Nigerian health sector was almost dying. You go to hospitals, there are no equipment, nothing. So a lot has been donated for this so-called COVID-19, which I think we can make a lot of progress if it's well channeled to the right things we need to get. So I think what we should do, yes, make testing more available. It's good to make the testing kits more available. Let's try and test a lot of people daily, so that you can actually know the number of people that are coming down with this disease. Yes, we know 80% may be asymptomatic. They may not even have symptoms. It may even come, they may have it and it goes without being noticed. But the risk of transmitting to others, that's what we are afraid of. That's why we want more testing to be done. How much is testing? Let these testing kits be made. A lot of money has been donated for these things. So let's make sure a lot of people are being tested. Those that are positive are well taken care of. The isolation centers should be at least well equipped, so that there won't be need of somebody running away, that the place is just like this and that. The place is not conducive and trying to run out from the place. So please, we should channel our resources. We should try to make sure things are done properly. And it will go a long way to help this nation.
All right, Dr. Safiya Owuda, consultant family healthcare physician, clinical director, Trust Charities Hospital, Jabi, Abuja. Thank you for joining us on the program.
You're welcome.
Our correspondent Hajra Aliyu brings us this update on the latest addition to the national molecular laboratories around the country.
Bauchi State now has the capacity for COVID-19 tests. This building behind me was constructed under 2 months, and it is the new reference laboratory in Bauchi State, owned by the state government in collaboration with the Northeast Development Commission and certified by the NCDC. The lab has been activated and it is set for commissioning. It was supposed to be commissioned today, but we have been reliably informed that the event has been postponed to a later date for some reasons. We spoke to the team leader of the project, Professor Sani Malami, and this is what he has to say.
This has been successfully completed. The team that came from NCDC has evaluated our laboratory in terms of the equipment which has been installed, which is the real-time PCR equipment, capable of amplifying and detecting very extremely low levels of viruses, but in this instance, the COVID-19 virus. In addition, the NCDC has determined that we have the right staff mix, the right staff component to be able to execute this assignment. We also have enough spaces, and also the safety standard of the laboratory has reached the level which is expected of a laboratory of that class.
Personnel training is one area of concern, bearing in mind what happened in Kano.
We were very lucky and also very grateful to the NCDC. The staff that came for the activation spent a total of 5 days in Bauchi, which is unprecedented. I believe they were guided by the experience they had, especially in Kano, unfortunately, where immediately after the activation, the laboratory had to be shut down because the safety measures were not properly implemented by the staff. They had a lot of contact with our own staff. They evaluated the capacities and the competencies of our own staff, and they were satisfied. And we are very happy that they spent so much time to put the staff through on what it means to run a laboratory of this magnitude, of this standard.
Before now, Bauchi State took samples to Jos and Abuja, but with this reference laboratory, it now has the capacity for 100 tests per day, and this will be scaled up with time. From Bauchi State, Hajara Aliyu for COVID-19 update.
Now, head teachers are reporting highly variable levels of attendance ranging from 40 to 70% as primary schools in England bring back more pupils, and also children in reception years 1 and 6. They are the first group of people to return. Mass testing continues in Spain and the region of Madrid in a bid to isolate coronavirus cases and stem the spread of the virus.
In Russia, residents of Moscow can leave their homes to take a stroll for the first time in 9 weeks under a partial easing of tough lockdown measures following a fall in coronavirus cases. Shopping centers and most parks, all of which have been fenced off for weeks, can also reopen from today. In Turkey, the Grand Bazaar, cafes and flights, gyms, swimming pools, beaches, parks, libraries and museums today resumed as the country eases restrictions. Shop owners say they have completed necessary preparations and looking forward to welcoming customers from abroad. Thousands of employees returned to work today as the Philippines' capital of Manila eased lockdown restrictions. Residents of the Southeast Asian nation's capital spent 11 weeks under lockdown, longer than the 76-day quarantine in the Chinese city of Wuhan, the global epicenter of the virus. There is no lifting of restrictions for some other countries still suffering health-wise from COVID-19. Chile reported that more than 1,000 people have died from the virus in the country, with 827 of the deaths occurring in the month of May alone, as the pandemic spreads quickly in the South American mining powerhouse. Meanwhile, in Mexico, the health ministry says the death toll from the coronavirus has risen beyond 9,300, with over 90,600 cases.
Be cautious is the message from the PTF and the NCDC. You can find the latest guide on their website. The centre continues to work closely with states, setting up treatment centres, training health workers to manage COVID-19 patients to recovery. Also, the World Health Organization has the latest update on the global response to the COVID-19 strategy. And don't forget, channelstv.com, our website, has more updates. You can find the latest on the pandemic in Nigeria and across the world, plus other stories. Thank you for watching. I'm Millicent Nwaka. Stay safe, stay healthy. We have another update at 9 p.m.